The actions that ministers can take to increase the supply and retention of mental health nurses, such as funding, training, incentives, and support. Mental health nurses are vital for providing care and treatment to people with mental health problems. However, England is facing a severe shortage of mental health nurses, which is affecting the quality and safety of services. According to the NHS Confederation, mental health nurses account for nearly a third of all nursing vacancies across England, resulting in overstretched services that are struggling to deliver timely care. The shortage of qualified mental health nurses is a systemic issue, which has been worsened by the COVID-19 pandemic and staff retiring or leaving for other jobs. To address this crisis, ministers need to take urgent and comprehensive actions to increase the supply and retention of mental health nurses. Some of the actions that ministers can take are funding. Ministers need to provide adequate and sustainable funding for mental health services, including investing in staff salaries, recruitment campaigns, education and training programs, and workforce development initiatives. Funding should also be allocated to support the mental health and well-being of staff, who are often exposed to high levels of stress and burnout. Training. Ministers need to ensure that there are enough places and opportunities for people to train as mental health nurses, both at undergraduate and postgraduate levels. This includes expanding the number of bursaries, scholarships, apprenticeships, and fast-track schemes for aspiring and existing mental health nurses. Training should also be responsive to the changing needs and demands of the mental health sector, such as incorporating digital skills, cultural competence, and trauma-informed care. Incentives. Ministers need to offer attractive and competitive incentives for mental health nurses to join and stay in the profession. This includes providing career progression pathways, recognition schemes, flexible working arrangements, relocation packages, and retention bonuses. Incentives should also be tailored to different regions and settings, where there may be different challenges and gaps in staffing. Support. Ministers need to provide adequate and consistent support for mental health nurses throughout their career. This includes ensuring that they have access to regular supervision, mentoring, coaching, peer support, and feedback. Support should also be available for staff who may face difficulties or challenges in their work, such as dealing with violence and aggression, managing complex cases, or coping with moral distress. By taking these actions, ministers can demonstrate their commitment and leadership in addressing the mental health nursing shortage. This will not only benefit the mental health sector, but also the whole NHS system and the country. As Sean Duggan, the chief executive of the NHS Confederation's Mental Health Network said, "The knock-on effect means that the mental health crisis the nation is facing will in turn become a crisis for the whole healthcare system and the country."